Hello and welcome to MommyDears. Today we're excited to launch our brand new segment called the MommyDears Expert Series. Over the past few months, we've received countless queries from mothers about pregnancy, childbirth, menstrual issues, and postpartum recovery. So, in this episode, we're bringing you expert answers from the most frequently asked questions. And for this, we are truly honored to introduce our expert guest, Dr. Veena Shinde.
Hello, I'm Dr. Veena Shinde. I'm an obstetrician and gynecologist and I'm practicing since last 32 years. It's a very beautiful journey and I've had very beautiful experiences in my journey. I started my journey with the hospital in Santa Cruz and I had the very cream of society. I also delivered my friend, my schoolmate in the first hospital where I practiced. So it was very overwhelming and very satisfying, and they were really happy that I was the doctor involved in the delivery process. That child is now almost 32 years old, married, and I delivered her baby also. Then I've had lots of patients with twins who I could deliver very safely and beautifully. Then there was a patient with twins, a high risk pregnancy, and she used to stay in my building. So I managed to treat her also. And then there was one more patient from Wakola with twins. Then I've also delivered triplets. Fortunately, I had the good opportunities to deliver such high risk pregnancies and lots of preterm deliveries. And I'm very happy that I could manage them very beautifully. What is egg freezing? Egg freezing is the procedure where we have multiple eggs, and these multiple eggs can be kept uh, during your fertile period. We can collect them and we can keep them when you want a child. That is like planning a baby, like you're freezing your eggs for conceiving in the future. Now you are 22 years of age and you have some time in your life where you can go to a gynecologist and freeze your eggs, and then later on when you're 35 you can use those eggs to get pregnant. So how is this procedure? When you get your periods, you approach to the doctor. The doctor studies your menstrual cycle, studies the follicular growth of the eggs, and according to that gives you certain medicines. With those medicines we get multiple eggs. Now these eggs are picked up by ovum pickup, and these eggs are frozen and kept in the containers, and then whenever you require these eggs we can take them out and we can thaw them and we can help them to give you live babies. It's a very well studied procedure and you can use it. So there's nothing to be scared. It is available in India. Is polycystic ovaries. Polycystic ovaries is a lifestyle disorder because of irregular eating habits, irregular sleeping habits. And what happens in polycystic ovaries? There are multiple eggs, but the eggs don't get released. They are stuck in the body. Because of that, the hormones are in excessive quantity. So you get hair growth at unwanted places, like you will get a mustache, you will get hairs on your hands, on your feet, then your stomach will grow in size. Also what happens is you become obese, and because of obesity you feel more depressed and you feel more hungry. You should avoid how to take care of this by having a proper lifestyle, having a proper time of getting up, having homemade food, having good sleeping hours, and avoiding sugar. Sugar is the main cause of PCOD. What happens is you get insulin resistance, and because of that your body cannot metabolize the sugar that you're eating. And so you should avoid eating sugar. You should have proper 8 hours of sleep. You should exercise every day for 15 to 20 minutes, and you should be happy. The most important thing is being happy. Now there is one more condition called endometriosis. Endometriosis means what happens is the blood that should come out during the periods gets spilt into the abdominal cavity, and there is lots of period pain. In polycystic ovaries you don't get periods, and in endometriosis you get period pain. This can happen even in adolescence. So please go to the doctor as soon as you feel you have a problem, and don't wait for the disease to spread. There is a medical line of management for this along with lifestyle, which you can take, and you can prevent yourself from getting chocolate cysts, endometriosis, and deep infiltrating endometriosis, which is very difficult to treat. MommyDears is a very nice platform which is available 24/7. Sometimes we doctors are busy in surgeries and you might have a small little problem which can be easily solved by the people who are on MommyDears. So you can ask them questions and they can give you quick solutions, because it's not always possible that you can reach your doctor. Although your doctor also wants to be always available for you, but there are procedures, there are deliveries, there are operations, and sometimes we are driving, sometimes we are sleeping. So whenever we are not there on the call, you have an option of asking MommyDears and they will give you a solution that is true, that is proper.